to this story now. So just how addictive are caffeinated energy drinks, and really what impact do they have on our health, especially on the health of children? This is, of course, coming out of that energy drink that has got the country talking, where we saw parents storming retail facilities or retail stores wanting to buy this pricey energy drink for their children. To talk to us about that, we are joined by Nzama Mbalati, who's Program Director at Heala, or Healthy Living Alliance. We're also joined by Medical Officer in Paediatrics, Dineo Sefoloko-Chitambo. Dineo and Mr. Nzama, thank you so much for joining us. A good afternoon. Nzama, I want to start with you, right? As Heala, what happened when you first saw the story, Nzama Mbalati? When you saw parents storming malls to buy an energy drink for up to 1,200 Rand. What were you thinking when you first saw it?
So you will realize that one of the things that are coming up with this story is that we were not really shocked, because the unhealthy food industries have really vigorously been targeting the low-income household, and with vigorous marketing strategies as well, hunting these products, also with celebrities endorsements and other marketing strategies that makes it cool for young people and for families actually to want to actually get their hands on these drinks. So we know that the vigorous marketing has actually entrenched, and the proliferations of these energy drinks and sugary drinks overall and unhealthy food to make it part of the lifestyle and our daily lives has actually deeply entrenched us into a situation where this has become a normality, and everyone wants to, a peak at work to be able to finish a day. And this is the energy that the body doesn't really need. But we understand that due to like a lot of marketing strategies and easy access that has actually happened, like in most of our communities, people are actually having these sugary drinks and energy drinks at including schools. If you look at the cafeteria and vendors at school, so I can control what I pack for my children for the lunchbox, but I can't control what they will have access to at school during learning and during breaks.
Yeah, I think that it certainly says a lot about the need for healthy food campaigns in the most vulnerable of our communities, because I mentioned this yesterday. You're not exactly seeing middle to upper class people storming the retail stores to buy this very expensive drink. It is, for the most part, South Africans that could be spending that money on something else. I want to bring you in, Doctor, and talk a little bit about what it is exactly that we actually need to be talking about the impact that caffeinated energy drinks have on our body. Dineo, I think about our children. Surely, if we know that our children should not be drinking coffee, what happens when we give them a caffeinated energy drink?
Hi there. So I think we're very right in identifying that the marketing strategy and the media today has made it so difficult for us to believe actually that besides caffeine, energy drinks and sports drinks are all that bad. When parents look at these drinks, they think of giving their child a sports drink after a match at school or something like this, as something that will give them an energy boost. And teenagers, of course, these days are wanting to look cool and fit in. But what we don't understand, and what we should be teaching everyone, is that any beverage that contains excess amounts of sugar, not just caffeine, but also all these legal stimulants, guarana, is actually an energy drink.
Yeah.
But as the gentleman before me has said, it's excess energy that the body actually doesn't need.
So do you know what actually happens to the body then? And I'm talking now particularly for children. So I'm talking about what the hazards are. So let's get into a little bit of the science so parents know what they're putting into their children could have real consequences. Yeah. We've heard of parents complain about even signs of ADHD in children. Could that be linked to these energy drinks? Even concerns around obesity in children. Yes. Let's talk about what are the risks that we're facing.
Well, if we look at the general systems of the body, the risks, the obvious risks are that of hyperactivity. We know that energy drinks contain a lot of sugar. So we've seen high levels of anxiety in these children, insomnia, hyperactivity, even sleeplessness. So a lot of these children's developing nervous system actually gets affected from a young age. We also see that the high sugars in these drinks actually affect their sugar levels. So not only are they at risk of things such as dental caries, but they are at risk of things like weight gain, which leads to overweight, obesity, and subsequently later in life, type 2 diabetes. So even things such as cardiac abnormalities, palpitations, even strokes later on. It's dependent also on each child and their system. So children are even more susceptible to the effects of these energy drinks and the caffeine content contained in them.
Yeah.
So a lot of health risks for children with these energy drinks.
Quite the wake-up call, and I think a wake-up call even for us as adults as well, who, and I'll admit also, admittedly, give in to some of those caffeinated energy drinks. And Nzama, just to talk to us a little bit about the work that needs to be done then in our communities to bring awareness to people, right? Where we're not just following a trend and it's social media and it's a cool brand. We're actually starting to think about the importance of what we put in our bodies and in the bodies of our children. Where are the campaigns?
So the campaigns, one of the things that we have started in 2017, 2018 was to work with schools in particular. Here in Gauteng, Soweto, in Tembisa, and one of the things we're doing involving the school governing body, the principals, the teachers, the learners themselves, in how do we create a healthy school a healthy school food environment where children can actually have access to healthy food at school. So if you see at also the cafeteria itself, like what is being sold at the cafeteria for children. So if you're giving your child money to carry to school, what they will be exposed to is energy, sugary drinks, is unhealthy food. So we are driving a social mobilization campaign in support of the regulation on marketing and labeling of food that the National Department of Health has released for public comments. And in that, together with the nutrition literacy that we have started 2 years ago to actually really entrench the science, of food in a simplified way so that community understand. And you see now, without a greater regulation of these energy drinks and sugary drinks and all this unhealthy food stuff that are available is easy access, number one. Number two is that there's lack of awareness. So if you look at tobacco, many people who are smokers understand the risks associated with tobacco, but that's not the same with sugary drinks, with energy drinks and unhealthy food. So there is a need for a greater regulation. So we have been pushing for warning labels on food. So it needs to show at the first glance. So if myself, I haven't studied dietetics or nutrition, I should be able at the first glance to understand and
to
say
know
that
what I'm
this
putting
food is
into
high
my body.
on sugar threshold, on fat and salt.
Yeah, Nzama, a very important point, and thank you so much for giving us your time. Keep us updated as well in that journey that you're taking to get the food labeling right and visible for us all to know what it is that we're feeding our children. That there, Nzama Mbalati, Programs Director at Heala, or the Healthy Living Alliance. Dineo, thank you so much for your time. Dineo, reminding us there that caffeinated energy drinks can lead to ADHD, obesity, strokes and heart disease as well in ourselves and in our children. So think twice before you put that in front of your child. Dineo is, of course, Dineo Sefoloko-Chitambo. She's a medical officer in Paediatrics.